So our study is using monotherapy revumenib in patients with relapsed refractory acute leukemia with KMT2A rearrangement. Revumenib is a small molecule inhibitor of the menin and KMT2A interaction. And in phase 1 study, it shows durable and deep responses with manageable toxicity. KMT2A rearranged acute leukemias, it's a high-risk disease, frequently relapse after chemotherapy and transplant, and options at this time limited to chemotherapy. So the Augment 101 phase 2 study for patients with KMT2A rearranged acute leukemias, it was agnostic for age and for histology, included patients with ALL, AML, acute leukemia with ambiguous lineage, if they have the KMT2 arrangement. Revumenib was given at the recommended phase 2 dosing at 163 milligram twice a day orally in combination with the strong CYP3A4 inhibitor. And the primary endpoint was CR and CRh, and there was a pre-specified interim analysis once the patient accrued 57 patients with the centrally confirmed mutation and patient had adequate follow-up. So the study enrolled 94 patients on the safety population cohort and 57 patients on the efficacy population. It included younger and older patients, including almost quarter of the patients being children and 11% more than 65 of age. And the majority had AML, and almost quarter of the patients were induction failure. These were heavily pretreated patients. Close to half of the patient had 3 or more prior lines of therapy, frequently had prior venetoclax, and almost half the patient had prior transplant. Now, the primary endpoint was CRh, and the study made the primary endpoint with CRh rate of 23%. The overall response rate for the study was 63%. The majority of responders achieved MRD negativity, and these responses were durable with median duration of CR/CRh of 6.4 months. Almost 40% of responders were able to receive consolidation with allogeneic stem cell transplant after response. Overall treatment was well tolerated, and only 6% of patients discontinue revumenib due to treatment-related adverse events. The most common adverse events was febrile neutropenia. Grade 3 or higher differentiation syndrome was observed in 16%. Grade 3 or higher QTc prolongation was observed in 14%, but no patient discontinued revumenib treatment due to differentiation syndrome, QTc prolongation, or cytopenia. Yeah, so revumenib treatment in our phase 2 study shows it is effective and safe in pediatric and adult patients with relapsed refractory KMT2A rearranged acute leukemia and produce durable MRD negative remissions and allow large proportion of those responders to proceed with allogeneic stem cell transplant. And overall treatment toxicity were manageable with low rate of discontinuation and dose reduction. With meeting the primary efficacy endpoint, the study was stopped early, and a new drug application for KMT2A rearranged leukemia has been initiated under the FDA Real-Time Oncology Review Program based on this data. I mean, we can add with the efficacy of single-agent revumenib and overall well tolerability and no overlap toxicity. With standard chemotherapy, revumenib is being tested in combination with chemotherapy in the relapsed refractory setting of KMT2 rearranged acute leukemias, as well as being introduced as a front therapy in combination with standard induction therapy in AML, older patients, unfit, as well as younger patients who receive standard 7+3, as well as their proposals to test revumenib in a frontline therapy in ALL as well.